Welcome back everyone to the State of the Nation. Now in our lead story tonight, human metapneumovirus. Is Sri Lanka safe? Now the Medical Research Institute of Sri Lanka has confirmed that the HMP virus currently spreading in China as a disease which has already been identified in a few instances in Sri Lanka. That's what was earlier said. But the health officials around the world are saying that the strain this virus is not as bad as COVID-19. But with the rate it's spreading, there are questions that needs answers. Let's get more data on that, and joining me now is Dr. Anil Jasinghe, Secretary to the Ministry of Health. Appreciate you being here, sir. Thank you very much for taking the time. Now, first, explain to us as to what's the difference between the HMP virus and the coronavirus. We're being told that this virus is not severe as the coronavirus. Is this the case?
Yes, Mahesh. Now, basically, HMPV, human pneumometavirus, is basically a seasonal virus. And you find it in global north during winter and spring seasons, and this is what is reported from China, northern China, and it's not a new virus. It had been found in 2001 in Netherlands, and even in Sri Lanka we have had it before, somewhere in 2023. So when it comes to COVID-19 is a new virus. We know that we had pandemic in 2019, 2020. But even if you take even COVID virus, it has become sort of endemic now. So it also basically causes mild illnesses, and the HMPV basically is an upper respiratory tract infection, and it causes mild infection, and the mortality is very much less.
Indeed, Doctor, earlier there were reports which said that the HMP virus was earlier detected in Sri Lanka and later was told no, it was not the case. What's the truth to that? Do we have the virus already detected in Sri Lanka?
Yes, now actually we have necessary facilities to detect HMPV virus. We call it multiplex method, which can detect about 33 viruses including HMPV. So we haven't detected any HMPV this year, up until now.
Absolutely. Doctor, what's your advice to the public to safeguard themselves from this virus?
I think it's pretty easy because public is used to safeguarding themselves of upper respiratory tract infections because of a sort of training that we had during COVID pandemic. It's simply about respiratory etiquette. If you are ill, wear a mask, and then if the flu, the viral fever spikes are going to be there, try and avoid crowded, places. So then, when you sneeze, cough, you do that without sort of spreading the droplets, and then those are the basic things, and wash your hands frequently and adequately. But then there's no reason for to be alarmed, even if there are going to be certain HMPV cases. It's not going to be a big issue, and because this virus, it is believed that this virus would not go into epidemic or pandemic, go into pandemic proportions. There can be sort of epidemic as it's what's happening in China. So in globalized world, these things can happen, but there is no alarm, and the Ministry of Health Epidemiology Unit is really focusing on this. There are several methods, sentinel surveillance in 20 hospitals for fever, and then also we call SARI, severe acute respiratory disease surveillance, which is conducted on admitted patients. So both these are routine surveillance methods, whether this kind of situation is there or no, not there. We actually conduct around the year.
All right, thank you very much. We have to leave it at that. That was the Secretary to the Ministry of Health, Dr. Anil Jasinghe. Appreciate it, Doctor. Thank you very much.